Good evening, everyone. Welcome to Product Overview with the Wellness Expert. And tonight we have the pleasure of having Dr. Joseph Thomas with us. He is an MD. He is, oh my gosh, he is so many things. He is OB-GYN. He is a heart health specialist, and so many more things. And I'm going to let him tell you what the rest of them are. He practices medicine here in Chicago, on the southwest side of Chicago, and he is an entrepreneur. So without further ado, I'm going to bring up Dr. Joseph Thomas, who is going to share and enlighten us. So Dr. Thomas, take it away. Can you give a little bit more of an introduction for yourself? I did the best that I could, but you are so multi-talented. I wanted them to hear it all from you. So go ahead.
Okay, well, really the most important thing is that I'll get into my training and experience, but the most important thing is that of all that training and experience is boiled down to I really can represent to you, each individual, what they need to know to improve their health way beyond what the average doctor can. And I'm going to make that as a claim, and then I'm going to prove it. So I always say it'd be better for people to dedicate themselves to researching things out so that they prove things to themselves instead of just taking one person's word. Look for some proof. So what's the proof? Well, consider your training or the nurse's training or your doctor's training. You should ask them five simple questions. Have you had any recent metabolic medicine or nutritional medicine training? So the last 15 years, that's what I've done. Yes, it costs another $150,000. There were courses I took that were $3,000 for one course. But I thought it was worth it because I'm being trained by the guys that work with Olympic athletes. This is advanced metabolic medicine and exercise physiology. So this stuff wasn't even known 5, 10, 15, 20, 30 years ago. And in fact, my colleagues who try to doubt what I'm saying say things like, well, if what you're saying is true, they would have told me when I was at UFC or Rush. No, they didn't know it back then. This is all new information. And thank goodness you got a phone with Google on it. You can search what I'm saying is correct or not. So like I said, the first thing is, did they have recent nutritional metabolic training? And yes, I'm board certified in metabolic medicine and nutritional medicine. That's something I would say 99 out of 100 doctors not only don't have it, they never heard of it. What's number two? Everybody through a counter should know there's such a thing as the endocannabinoid system, but that wasn't taught in medical school. So they don't understand that the CBD or the endocannabinoid system affects how your body handles stress. And since a lot of places say stress is the number one cause of disease, we don't know how to handle stress. CBD? It's a problem.
No tincture? Yeah. You should be taking a tincture, Tanya.
Is there a question?
Your tongue. Oops.
So if not, I'm going to continue. So the endocannabinoid system, exercise physiology. If they haven't taken exercise physiology in the last 5 years, they don't know that exercise releases a hormone that makes your brain connections better. So these are just three things. The other thing is I took the course at Harvard for Benson's course on mind-body clinical medicine. So they have proven that meditation can affect how your body's nervous system, your gut, and your body well-being. So we'll stop at those four. Those are the things that they need to know. Uh, to move on to five, I think probably everybody on the call may have heard about glycocalyx, which is an inner lining of your capillaries, and you have between 60 to 65,000 miles of these capillaries in your body. So when the inner lining wears out, your blood flow is decreased. When your blood flow is decreased, every single cell, tissue, and organ is starting to relatively have a decrease in nutrients or starvation. So once this machine called a glycocheck machine was discovered by Dr. Vink, who I met in Atlanta, and it's been brought to this country, this is a game changer because we can measure and predict, are you going to have problems in the near future if your score is low? If your glycocheck score is low, you don't have good circulation, and those are the people who end up having, they could still be young, 30 years old, 35, and have a stroke or a heart attack because their tiny vessels aren't functioning. So this is a whole new realm of medicine, and I propose that each patient and each doctor needs to think about three things before you do anything else. What's the stress? What's the toxins? And what's the deficiencies? Because that's going to determine whether you have oxidative stress that damages your cells or inflammation that damages cells. So as an introduction, yes, I have board certification in metabolic and nutritional medicine. I've studied that for the last 15 years. And when you get into detail, I've been doing this kind of research since the age of
I work for a
18.
technology company that allows me to help people
And that's when I was at college and figured out I got sick because nutritionally, they poured the water off of the vegetables in the vegetarian cafeteria. So if you pour all the minerals and vitamins out, that person becomes deficient and got sick. So that started my research at 19. So here, 50 years later, yes, I've amassed thousands of books, papers, seminars, certification through A4M, Anti-Aging Society, and Functional Medicine Society. So I have the background, not just as OB-GYN, but as a integrative and functional medicine specialist whose education has surpassed 99% of the people in practice today. Now, they can take these courses, they're available, but you have to have will, and then you have to have the skill set. So I'm going to stop there, and if I could share the screen, I'll share some things that would help make certain points. Can we do that?
Yes, you can. You're a co-host.
I think this is the best place to start. We're going to look at not just stress hormones and health, but we're actually going to get to the slides that talk about blood flow. And since this is brand new, well, let me just tell you how new it is. So as a member of, the brand member of New Life Sciences, I'm one of 3 doctors in Illinois that have this technology. And actually, I'm the only doctor in Chicago, the other 2 in the suburbs, either south or north. So what I like to point out is everything that I have learned, I can see how it's really about you. It's how you and the listening audience can benefit from this information, even though I can present it on a technical level. We're going to strive to make it so simple that everybody can understand. And so we're going to try to identify, well, what's the purpose? So the idea and the purpose is to eliminate the things that specifically make Black Americans have a higher cancer rate, a higher high blood pressure rate, a higher kidney failure rate. All of these things now have been scientifically proven to be due to a blood flow problem, which we now have something to correct, due to a lack of vitamin D, because that affects your immune system, is due to a lack of omega-3, because your cells are being made of omega-6, which is inflammatory, that causes those cells not to function as well, and lack of vitamin C. So if you put those four things together, you'll find that's where the deficiency is. So you could say a lot of people have the same stress at work, but if you have those four things, blood flow, vitamin D deficiency, omega-3 deficiency, and vitamin C deficiency, then the next thing that happens is going to affect that group of people worse than any other group. So I'll give you a couple of quick ideas. I covered this other time saying, if you can't see really what's on the inside, and I just told you the four things that's on the inside, you would look at a tree and say, you don't know which one the storm is going to knock down. But if you know the inside of the tree has problems, that's the tree that's going to fall. And that's why Black Americans die sooner than any other group. What we have, and that's the difference between sudden cardiac death, which 50% of the people who die never have a symptom, and it's because you don't have any flow. If there's electrical malfunction, your heart's beating so fast there's no flow, that's it. If there's no flow, because a heart attack actually damages the heart and it stops beating, it's over. So heart disease is the number one cause of death in the United States for everybody. Now, there's some doctors who have learned how to prevent it, and those who want to look it up, you can look up Dean Ornish out of Harvard since 1984. I think 1990 he wrote his book, and Dr. Esatil out of Cleveland Clinic, who was the chief surgeon, who stopped doing surgery because he said, I can reverse heart disease with diet and stress reduction. So these are people who've written books. I'm reading what they wrote. I'm not doing the research. I've done research, just so you know. I've done 4 clinical trials. I'm the PI, or the physician investigator, on these clinical trials. These are multi-million-dollar trials where they wanted somebody in Chicago to be part of it. And of course, as you may or may not know, Black people are seldom part of clinical trials. So they reached out to me, and I've done 4 clinical trials. 2 were on COVID. So I read everything possible on COVID. And my depth of knowledge on that is frightening to some people, because I know more about endocrinology. I know more about the immune system, because I had to read all those things. Because I wanted to know, here's what we're doing with a natural product to help people not get COVID. And I'll tell you, even though they did the research and there's papers, you can Google vitamin D and COVID and see many studies that show the higher your vitamin D is, the lower your risk of getting COVID. Those studies are available. Well, I took it a step further and found out that any of my patients who had a vitamin D over 80 could not get COVID. 20 people in their household. You say 20 people? Yeah, they had a 2-flat and they had 20 people in there. Went to the funeral of a relative, and every single person got COVID except for them. And guess what they said to that person? Oh, you must have a false negative. Because you can't be negative if everybody else is positive. So we have seen the results, and we want to show you something that, well, I'm gonna go back. So this is when I did, I think it was 2019, the middle of COVID. I did the presentations at the Omni Center in Atlanta. This is CNN Center, the Omni Hotel. So we were talking about, if you can see my arrow, normal, lining of your capillaries, and deficient. This keeps the equilibrium. This makes it leak and damages your tissue. So these are things that are proven, and we want to let you know that there's something we can do to help each and every person, because if you have uh, any degree of your stem cells being abducted, then your future health is going to be disastrous. And that's what they're doing with toxins in the food. So this, you can read this for yourself, but your stem cells are being abducted or aborted or turned off by these toxins. And I'd like to point out, a lot of people don't know this, but they have a code pink in the hospital. This is the highest state of emergency in the hospital. Everybody has to stop what they're doing and guard the exits, because code pink means there might be a baby being abducted or kidnapped. Code pink is the highest code. Well, 100% of your health depends on your stem cells being alive and well and helping each organ replace itself or renew itself. So any amount of mercury, aluminum, or paraquat, which is a herbicide, turns off your stem cells by a molecular mechanism, and that was by Mark Noble at the University of Rochester. This is a published paper. 6 months later, I went to find this, and it's now been covered up. It's hard to find. They changed the wording. They don't want you to know any amount of mercury, aluminum, or toxins. Why is that? Because they got mercury, aluminum in vaccines. So they don't want you to know that's turning off your stem cells. That's why people are getting sick. So when you find out, you'll look like this lady to the right. You'll be screaming with anger when you realize it doesn't matter, accidentally or on purpose, there are things being put in the water that are causing problems. Well, what's in the water? Chromium 6. Just look up chromium 6. You'll find out that's the stuff from that movie a long time ago called Aaron Brockovich. And it was about, if chromium was in the air, you got cancer. It's in the water, you got kidney failure. So why do Black people get more kidney failure than anybody else? When you read the research like I have, you say, well, it's more than one factor. Chromium 6 should affect everybody, right? No, if you're vitamin D deficient, it'll affect you more. Hypertension, more Black people have that, it's going to affect the kidneys more. So there's something we could do, and it's not taking drugs that cause a side effect, so you need another drug that causes a side effect, so you end up on 6 or 10 drugs. The older you get, the more drugs. No, you need a natural substance. So it costs too much. They spend all this money on health care, but it's because they're doing things to make a profit that is contaminating the food and the water. So we're going to transition to the other presentation. To put it bluntly, I'm not trying to scare anybody, but this as a graphic representation is a molecule that was created that has HIV determinants and malaria determinants that could only have been created in a lab. proven by the microvascular correction, the microbiology and virologists in France and 2 other countries. Here's the studies that show, and you can see my arrow moving. If you look in healthy controls, this is a substance you can measure in the blood. The higher this gets, the more glycocalyx is being damaged. You can see healthy controls, very low. Hyaluronic acid, healthy controls, very low. So the spike protein caused a tremendous amount of damage. Who had the most damage? The people who had COVID-19 and ventilation. So when you put them on ventilation, that increased the amount of damage, and that's why more of those people died. Proven here, this was a study, the guy inventor is Dr. Vink. It proves it here, that the vascular density is measurable, and this is the percent. So 4 micron blood vessels, 5, 6, etc. So their machine is measuring that. So this shows the controls. I gotta move some things. The controls had better blood flow than the people with COVID, and who had the worst? The ones on ventilation. So let's look at the next study. Okay. This may be a little technical, but the chance of surviving is reduced in patients that have damaged glycocalyx. If you have a high amount of damage, those are the people who they were all dead by 40 days after they got it. If you have low damage, 100% of these people live. So after 10 days, you can see it was 75% had already, we'll put it like this. In a week, 10 or 20% were dying. If you looked at 20 days, half of them. If you're going all the way out to 40, 45 days, all of those patients had passed who had COVID at that level. So the damage amount of glycocalyx, where the PVR is more than 2.3 microns, and that's what we were measuring with the machine, because this is a sepsis and COVID study in Munster Hospital. That people with healthy glycocalyx, 100% live. It's also, you can do a screenshot, but it's also called a mystic study. It's in a book called Angiogenesis, and these are the authors. Glycocalyx damage corresponds with non-survival in COVID-19. This is the biggest study that proves it's your microvascular blood flow. That's important. Next. You can actually use dye and measure the glycocalyx. So that's a big, word, glycocalyx, to say it's reduced in the people with an ICU that are septic. And if you give them Fucodan, you reduce the amount of damage. In other words, restore the blood flow. So let's go back. So that's technical. It's on the inside. It's hard to really read these scientific papers. But here you can see someone who had very high resistant blood pressure, has a non-healing wound. Look at that blood pressure, 200/110. When is that? April. By May, they're taking Endoclyx, the pressure is down. You're getting some granulation tissue. That means it's healing. 3 months later, it's healed much better compared to this open wound. This person was going to have an amputation. By October, which is 6 months later, it's almost completely healed. This has been proven in animal studies as well as human studies. This is showing the blood pressure in the young compared to the old. And now here's the old with Endoclyx. The blood pressure has come down. How much? 25%. And of course, they do studies in mice first. The effect of the supplement, old, their percent of baseline is very low compared to young. But as soon as they gave them Endoclyx, you got recovery, which is why this works so well. This is the proof. It changes sodium sensitivity. So I'm not going to spend a lot of time on this, but everybody's heard, oh, you got to watch your salt. So if you could follow me, do you see how thick this glycocalyx is? So that buffers the sodium in and the sodium out. Do you see how thin the glycocalyx is here? This is the person that has low sodium buffer capacity. So they have delayed renal sodium elimination, and they're at high risk for cardiovascular, heart attack and stroke, basically. So this has already been proven. They do tests to see, well, here's normal intensive, 32% of salt sensitivity, 20%, 48%. So the ones with high blood pressure, much more sensitive to salt. But that's because they don't have that buffer zone. So again, these are various measurements. Diastolic pressure, much higher. Body mass index, higher. Systolic blood, the top number, much higher. So they've done the studies to prove it. I'm going backwards because I rarely get to that. Here's kidney function. Somebody asked me about kidney function today. Glomerular filtration rate. So in case you don't know, normal is, let's say, 100. You in your teenage years, this might be up to 120, 130. Here's my biggest concern with my patients and my family. They don't tell you you have kidney failure of stage 3 until you're at 60. By the time you're at 60, you're not too far away from needing dialysis. They should have told you when it dropped from 100 to 80 or 90, hey, you better watch that ibuprofen or Motrin you're taking. So in case you don't know, if you take a bottle of Motrin today, your kidneys won't be working tomorrow. Just like if you take a bottle of Tylenol today, then by tomorrow your liver will no longer function. So they should tell people when they're starting to have this drop, don't take any more Motrin, that's killing your kidneys. So here's a person who already had kidney failure. They started glycocalyx therapy, which is the Endoclyx. After 2 months, they got some improvement. Here, and I forgot the reason, but for whatever reason, they stopped it from here to here. They measured it again, it kind of dropped. And then here at about 8, 9 weeks, they restarted it, and now their function is back up to 80 to 90. This was a person who was about to need dialysis. This is a person back to normal. So if you get below, 10% and your kidneys are scarred, I don't think this is going to work. You need to start way sooner than when they say you have stage 2. Stage 3 starts at 60 and below. So this study was an eye-opener to me, because if you can improve the blood flow to your kidneys and restore kidney function, that's one of the biggest problems. And they're not going to tell you that because what? They want you to be on dialysis. So let me ask you a question. Would you think the company that is a dialysis company nationwide would be interested in this Endoclyx to treat kidney function? What do you think? Let me tell you why they were thinking about buying it, but then they changed their mind. Why were they thinking about buying it? The average person who gets on dialysis, let's say they last 7 to 10 years. And now they're not a patient no more because they're gone. That's what happens. They knew from the studies, if they put all those patients on Endoclyx, those patients wouldn't be gone after 7 or 10 years. They could last another 10 years. So that would mean they would make more money, right? So they were thinking about buying it. Then they did another calculation and said, if we gave it to the people who were just starting dialysis, half of them would get off dialysis, so we would actually lose money. So they backed out of buying it. So that just tells you they're doing a calculation of profit and loss to make these decisions. So to me, it's clear that the mantra is profit over people. So once you see that it's profit over people, now you can read between the lines and see that the evidence is clear that we got a problem.
Dr. Thomas, when you said that the dialysis company was going to buy the Endoclyx company, is that what you were saying, or the NU Life Sciences?
Yeah.
Okay. So the product that was invented by Rob and Hans Vink, they were going to buy that company.
They were going to buy that company.
Okay.
So they could have control over the Endoclyx. And it worked too well, so they calculated that they would actually lose money. But here's what they didn't calculate. They should have called me. I would have helped them. Here's the real calculation. And I'll put it to you guys, right? Whoever's listening. You could hear what I'm saying, and I'm going to throw out a challenge. With the biotesting, the biomarkers that I test, I can find out what's wrong with you 10 or 15 years before you have a complication, and we can prevent it. Now, if there's 100 people listening, what percent do you think is going to come see me to get tested so we can figure out what the real problem is and prevent it? Now, can you see there's movement on the screen or not?
Yes.
Okay, good. So what this is showing you is this area here is the glycocalyx, and it's keeping your red blood cell from hitting up against this capillary wall on both sides. When that's not here, it hits the edge that damages it, and then things leak out and problems are caused. So it shows you the single red blood cells. It shows you the vessel wall that's one cell layer thick right there. And that's the new finding that of the 10 doctors I spoke to, only one anesthesiologist had ever heard of glycocalyx, because when they give you IV fluids too fast, it might damage this layer. So they're aware of it. But the regular doctor in practice, it hasn't reached them yet. So believe me, if you have a doctor in practice who you think is ready to find out new information, let me know, because I will share it with them, because I'm happy that those of you who are listening had the opportunity to get the glycocheck test done by me or take the Endoclyx and order that through Akana. But we also want to get your doctor up to speed, because my mission is to make all of those who I can touch on the South Side reduce the heart attack and stroke by more than 50 to 70%, reduce all the cancer rates, because yes, if we change how you and your family are using nutrition to improve your life, it'll make a total difference. What do I mean? If you take Endoclyx and eat a better plant-based diet, the nutrients will get to your cells better because of the Endoclyx. If you take vitamin D, your immune system will work better and you'll have less chance of getting cancer. What group has the highest rate of cervical cancer? Black Americans. Why is that? the HPV, human papillomavirus, 16 and 18, is the two types that infect the cells and cause the most cancer. But if your immune system is working, you clear those HPV out in less than a year and you don't get cancer. So the Endoclyx, step one. Well, we won't say step one, but one of the steps. Vitamin D, 10,000 a day, another step. Omega-3, at least 2,000 milligrams a day. So let me explain this. And these are facts. I say it's my opinion, but you can look it up and see it's a fact. The one who made people decided that when a mom is pregnant, the baby could take anything the baby wants. That baby could take your protein, your calcium, and the first, second, third baby will end up taking 85% of your omega-3. So all of your cells will be suffering. You've heard of pregnant women having teeth fall out because the baby took all the calcium. So these are facts that I've uncovered through research. And I used to think, well, it's a coincidence that they're not letting people know this. It's just hard to explain. No, it's not hard to explain. So my average patient I explain it to, they understand it, or at least they tell me they do. I am going to say only about 50, 60% actually follow my instructions. But that's a whole nother topic on another day. But those who are listening, especially if you've heard this more than once or twice, you can totally turn around your health. And for those who want to have a deeper dive, yes, I have what I call Restore 360 programs. So for an example, if you or a loved one has a severe problem that needs help right now, you probably need IV super nutrition. So first we got to fix the blood vessels so that they take the nutrition everywhere. Then we can't wait 3 or 6 months for these micronutrients to make it to the tissue. For an example, as soon as you get a cold or an infection or cancer, it uses up all your vitamin C. So those people, I need to give you massive doses of vitamin C, both through the IV and what's called liposomal vitamin C, so that your antioxidants can fight off the free radicals or the cancer cells. So IV super nutrition is right up there for the people who are really sick. If you're not really sick, you don't need an IV super nutrition. You just need to eat right. So there's so many things that we could do to turn people around that it's unbelievable. I don't even have time to go into what redox medicine is. Reduction, oxidation, redox. Every single hormone and every cell identifies things that need to be fixed by using redox molecules. And so that's another whole discussion, but that's the layer underneath what you've heard about. That's the layer underneath how fruit and vegetables and vitamins and hormones and things work. It's a signaling system. Your brain has to know when your body needs different nutrients, and somehow it tells you to go eat different things. Now, we're so smart, we don't listen to that. We say, well, I want a Big Mac. Well, I want to get some Kentucky Fried Chicken. But your body is actually asking for other nutrients. And I try to explain it. As an OB/GYN doctor, you have to understand, I know full well, and you guys know too, are there people who eat, they're pregnant, and they eat starch? Anybody ever heard of that? So this pica is when you need one thing, but you're eating something else. The only people who might have got some nutritional benefit are the people like in Georgia that ate that Georgia red clay. That actually had minerals.
Yes, and Alabama.
Yeah. So I don't recommend that, but I'm just trying to get you to understand when the pregnant girl is craving something and she eats starch, that's not going to help her. When these little kids is chewing on paper, that's not going to help them. If you have a dog that's chewing on wood, that dog is mineral deficient. Maybe if you ate enough wood, there are minerals in wood, but no, give that dog some minerals. Give them kids the nutrients they need. They'll stop eating paper. The dog will stop chewing up wood. And if you get the right micronutrients and the right probiotics in your system, then you will stop craving carbs. So again, that's a whole discussion about the bacteria in your gut. If they're the wrong type, send a message through your vagus nerve to the brain to feed them what they want. What do those bacteria want? They want carbs. So I'm here to tell you, you are like a host. You got 70 trillion human cells. You have 10 times that number of bacteria and viruses in and on your body. Your body is only 40% from the human genome. It's hard to believe, but you can look it up. The DNA, the genes from bacteria and viruses is part of your human system. It got translocated there. So when you have various difficulties, we need to have the right food to turn the right genes on, to turn off the genes that are not helpful. That's called epigenetics. So yes, genetics is important, but I don't care if your family got 3, 4, 5 people that got diabetes. We can have you do the right thing and turn that gene off. So you don't have to get something just because it ran in the family. So for those who are wise, you know the main thing that runs in a family is not genes, it's your habits, it's your culture, it's your conditioning. They had what do you want to call it? An unfortunate experiment with some twins. Unfortunately, the parents died. Nobody in that family could take both of the kids. So one kid with the one family, one kid with the other family. So in case you don't know, identical twins have the exact same genes, period. But the kid who went to the family that smoked, drank, ate junk food, that kid got cancer by 25. If it was genetic, then the other kid should have got the same cancer. It's not genetic. So you can influence the genes that are helpful, in other words, turn those on, turn off or silence the genes that make you sick. So I don't have a slide to show you, but let me move on. This is showing you, if you can see my arrow, this fuzzy stuff is the glycocalyx that you want to replace using the endocalyx, and the effect of this is what we measure using a glycocheck machine. This is the one cell layer of your capillaries. So as your cells are moving, they're not touching this area. The white blood cells come over here and brush against it. It protects the wall from damage, let the nutrients in and the toxins out. And now this is what releases nitric oxide. I tried to answer the question about, everybody probably heard of super beats and beat this, beat that. People who take that, they don't have this area that holds the nitric oxide in, it can get to the brain combined with super oxide dismutase, which is a very common enzyme, and create a toxin called peroxynitrite. And that's what is associated with 60 different chronic conditions. So you should not be eating those super beets and all that kind of stuff if you haven't taken endocalyx and replaced the lining where the nitric oxide is supposed to be. And again, you can easily look that up. In other words, excess nitric oxide in the brain is what's causing damage. Nitric oxide released here in these blood vessels is helpful. It causes vasodilation or movement. I think we got a slide to show that. This is the slide that shows when nitric oxide is released from this layer called the glycocalyx, this capillary opens up and allows better flow. Look how fast it's going now. So when you have an injury site, this is when the oxidized cholesterol starts to build up and you have plaque formation because you don't have this protective layer. So this person is going to have atherosclerosis. And I mentioned before, and I want to highlight it, when I was in med school, the cadaver lab had individuals who had died. One happened to be a 6-month baby. The professor had opened the carotid and showed us this baby at 6 months has a plaque starting right here, just like this. And we said, well, why the heck is that? The baby's only 6 months old. He said, well, they feed babies, if they're not breastfeeding, carnation milk, Karo syrup, which is fructose, and concentrated milk. That's causing a plaque. What happens in Korean War, Vietnam War? They did autopsies and found them kids, 19 or 20, who died in the war, they already got plaque. So I try to explain to my patients who don't want to hear it, I know you feel well, you don't think there's anything wrong with you, but you already had the beginning of heart disease, because heart disease is the #1 thing that kills people in the United States. And it started in that late baby's case at 6 months old. This is showing you here the carotid and the sinus, how much dye is being taken up to show you this is good. That's the endocalyx. This is the blood vessel lumen. This doesn't have that endocalyx, so stuff is leaking down into the endothelial space, and that person is going to be sick. The LDL leakage. This is the bad cholesterol they're talking about. That's why it gets in there. It's not that it's bad cholesterol, it's that you don't have that protective layer. So everybody can read this.
Yeah.
This is how you end up with calcification that starts the problem. This is, let's say this is the good glycocalyx. You see that looks like hair? Hair is missing. So this person is going to get calcification. So for some patients, I tell them, well, listen, you're already at the point, you need to buy this vitamin D I carry that has K2 and iodine, because K2 takes the calcium out of your blood vessels and helps it get to the bone where it belongs. And if you're not eating a lot of green leafy vegetables, you're deficient in K2, so you might as well take it and change your diet at the same time. Don't just say, well, I'll change my diet. Yeah, when? After the summer? Because we're going to the picnics to have barbecue this summer, right? So through research and innovation, 180 different universities have already done the research to prove all this. My medical student, I brought him up to the center this morning, and I'm gonna have him pull all the papers from these universities, give me the names of the investigators so I can call them, because they're the ones who would be most likely to listen and try to institute people taking endocalyx at their university. The other doctors who've never heard of it are going to say, well, who are you? You're an OB-GYN doctor? You can't know more than microvascular health than I do. I'm a cardiologist. Yes, I do know more than most cardiologists, because I've spoken to them and this isn't made it to their literature yet. So if you have a cardiologist, he hasn't heard of this. The patients I have that have cardiologists, I give them papers for them to read, and they're like, well, we never heard of this. And they're flabbergasted. But since this is a supplement, no one's coming to their office to bring them lunch and give them a detail to tell them about it. So that's the problem in a nutshell. Here we're back to what I wanted to show you. This is a camera. My camera looks a little different because it's a research camera. So you see this World Intellectual Property Organization patent since 2009. And this is the guy, the inventor who I met when I went to Atlanta and started getting this information last year, 2013. If you have these conditions, they're researching this. This is the way for them to put it lightly. But as a physician, I can just say it. These conditions are caused by your lack of glycocalyx. So they can't say that. If you're not a doctor, you can't make a diagnosis or talk about a supplement that can cure something. That's against the FDA. As a physician, my job is to make diagnoses and to prescribe treatments. So I can tell you, hey, if we fix your glycocalyx, all of these problems will be improved. I have a patient right now. She took the endocalyx, and in 2 months, she lost 40 pounds. So when she told me that, I said, well, hold it. We're going to have to explore that, because endocalyx is not a weight loss medication. I said, so tell me what you were doing. She says, well, The month before I took Endoclyx, I started eating better. I started working out. I was getting more sleep. I was getting better nutrition. But since I took the Endoclyx, my workout is like triple. I can go much longer. I'm lifting heavier weights. I'm doing this.
Hello.
Yeah. Can you still hear me or not?
Yes.
Okay, because I heard a lot of back chatter. So that's how she lost the weight, was that her blood flow improved, her exercise improved, and that's how she lost 40 pounds in 2 months. It wasn't just Endoclyx, but the Endoclyx helped. So this is showing what I consider, you see this small vessel here? Does anybody see how fast this is going?
Yes.
The other people I've tested, this looks like little dots walking on a sidewalk. This looks like a racing car flying down the street. The ones who have poor flow, it's a dot that's just walking slowly. So I can look at the glycocheck while I'm doing it and can tell in advance, oh, this person's score is not going to be very good. If I see somebody is flying like this, they're much better. So here's someone that was fairly good, a 6, but then later after taking the glycocalyx, it went up to a 9.7. So they put this graph on here to, show the difference, but it says 12, 12, 12, 12, 12, but it actually was a different time frame where they put this on here. And these are the two guys I met, Dr. Bob Long and then Dr. Hans Vink. You can look this up, the blue zones, and read about what they eat there. And some of the ingredients come from this place where the people have a tendency to live the longest. Loma Linda, California. There's a place in Greece and Italy, in Okinawa. There are 6 of them, but for some reason, this one only shows 5. I know that there's an Adventist community that also has long life. So here's what's in it. Polysaccharides, which restores the glycocalyx or sugars, amino sugars, which is a precursor for the biosynthesis, and then you need antioxidants to prevent the breakdown. So yes, I tried to find polysaccharides on seaweed and put it in a smoothie to save money. It was so nasty, I had to throw it away. I called a company and I said, well, how much of that stuff is in there? They said they take a bushel, and I'm just gonna say 5 pounds because nobody knows what a bushel is. They take 5 pounds of the seaweed, extract the essence, and that's what's in 2 pills. Well, I can't put no pound of seaweed in a smoothie and drink it. So that's why I know that this is the best way to restore and protect this layer that you need. So I pretty much covered it. I just wanted to show there are people who, this is saying within 2 months, their score went up. 2 months later, their score is up to 6.7. So many of you, including me, would see that and say, okay, it went up 2 points every 2 months. Big deal. So what does that mean? Well, a lot of people who are on tonight heard the testimony of a woman who said her blockage was 70%, and 9 days later, the blockage was only 20%, and they didn't have to do a stent. That is the most eye-opening testimony I've ever heard. I know some people, one doctor who was a chiropractor and one of my patients' mom, who both had heart attacks. One had to have a stent, and they said, in 3 months, when you heal, we're going to give you 2 more stents because your blood vessels are blocked. The lady with the bypass, they said, in 3 months, we're going to do a bypass on those other 2 arteries because they're too blocked. They took double dose Endoclyx for 3 months, and when they went back, neither one had any blockage. So I knew that it worked in 3 months. That's why I took double dose for 3 months. But now we find out a lady reversed hers in 9 days, and it didn't go to zero, but from 70 to 20% is in my book, that's a miracle. So I want to leave you with the idea that we now have the science and can prove certain things. Here, I'm going to try to enlarge it. It may or may not work. No, I can't make it work. Okay, so you have to look at it at normal size. And what you'll see is that these are the red blood cells that's moving, like somebody walking down a path. See that? Anybody see that?
A little
Yes,
bit. Yes,
I see it.
yes,
See how slow it is?
Yes,
So if you're over like 40 or 50, this is you. If you're over 30 and you've had a lot of fast food, alcohol, lack of sleep, high blood sugar, this is you. So this is you. In this case, they're saying 4 months later. And I got to move this thing. There you go. Can you see how the blood is flying through here?
yes,
So when it goes that fast, you got better blood flow. And if you look here on this side, on the left side, you see it's like a vacant lot. There's not too many capillaries. You see that?
yes,
If this was your garden, there's nothing growing.
yes.
4 months later, it's totally different. You have blood vessels everywhere. So it's my belief and my personal experience that in 2 or 3 months,
You'll be
you will no
better.
longer forget where you park your car when you go to Walmart. Because the blood flow is going to improve in that part of the brain, the hippocampus, that's responsible for memory. Now, we'll tell you if you had that problem, come see me because there are other supplements that you need to feed the brain. But the first thing is to get the blood flow better, because if the blood flow is not better, the nutrients aren't going to get there. And again, even though this looks better, I just want to point out, this score was 0.6. I say if you under 1, you got a high chance of cardiovascular damage or a stroke within the next year. This, it went up to 3.9. So over 3 is getting there, but you really want yours somewhere between 6 and 10. So that shows the movement. So for those who follow what I'm saying, you can feel absolutely fine on the outside, but when we take the scope and look on the inside, we can see a year, 5 years, 10 years ahead of time that low blood flow is causing your organ to slowly starve and they're going to slowly lose function. Nobody gets a warning that your kidneys are slowing down function, and they don't even tell you till when it's down to 60% instead of 100%. You may not feel any decrease in your heart function, but I want to challenge you guys. All you have to do is walk up 60 stairs in under 90 seconds. Find a place. If it's your house, go up and down the stairs, count 60 stairs, do it in under 90 seconds. If you do it and you're not out of breath, I think your score is going to be pretty good. If you can't do it, you got problems. The other test you can do is just step up on a 1 foot step with each leg individually, step up with the right, then the left, and then down with the left, and then the right. Do that for 3 minutes. We check your pulse before, when you finish, and see how long does it take your pulse to go back to normal. That's your cardiovascular wellness check. If your pulse doesn't go back down fast enough, you got a problem. So these are tests you can do that's better than an EKG, because EKG says, oh, the electrical conduction is normal. That doesn't tell you anything. a stress test, they don't take it up to 60 steps in 90 seconds. They'll slowly ramp it up. And if you get to a certain point, they'll say, okay, you passed. But a large number, over 5% of people who pass a cardiac stress test could be dead within a year or so because they can't measure these tiny vessels. So this is a game changer. And who needs it the most? African Americans, because they have the worst disease. So that's where I'm presenting it first. I've gone to different organizations. I'm going to continue. If you have a doctor, I will show it to them. If you have a church, I will show it to them, because my goal is to get it through the community that needs it the most. Who's getting it the most now? The wealthy that can afford anything. But I will be the first to tell you, if you don't invest in your own health, then your money is going to be spent on sickness. And everybody knows that. I really don't have to say that. I just want to quickly flip the last couple of slides. These are warning signs. Anybody have skin problems? That's microvascular health disease. Fatigue, memory loss, type 2 diabetes, PMS, eye problems, lack of focus, thinning hair, high blood pressure, cold hands and feet, leg cramps, hearing loss, slow wounds, erectile dysfunction, neuropathy. All of these are telling you you have a microvascular health problem. The circulation is slowing down. Let's do this one. Just okay. That lining gets damaged by the following things. You can read it along: aging, poor diet, lack of exercise, genetics, stress, smoking, and conditions like diabetes and hypertension. So I told you the good story about my patient who had a bypass and in 3 months didn't need another one. Or the doctor I know, chiropractor, that had a heart attack, they put a stent and in 3 months he didn't need another one. I told you the story about the lady who volunteered her story and said she had 70% blockage, and 9 days they did the test, it was down to 20, and they said, oh, you don't need a stent, it's improved tremendously. But here's a story that I'm gonna tell you, which, you know, I do my own experiments. At least I call it that. But it really just was a mistake. So here's the mistake. So once I got my score 8.6, and the guy said, oh, we rarely have people that high, then I thought, well, I'm doing something. So when my birthday came, I said, well, it's my birthday, I can eat whatever I want. Then I said, well, it's my birthday weekend, I could eat wherever I want. And my buddy called and said, hey, let's play golf. So I went to play golf, and he bribed me with a cigar from Cuba. I said, oh man, I gotta have that. So I smoked a cigar. And, you know, all through medical school, residency, I'm staying up late doing deliveries. So when the weekend comes, I'm not on call, I wanna watch my favorite Kung Fu movie, I'll stay up to 1, 2 o'clock in the morning. So I almost did everything on this list, starting with aging, poor diet, quit exercise. I was going to the gym once or twice a day. I quit doing that. I did play golf, but that's riding around in the car, drinking beer. So long story short, my score went from 8.6, it dropped all the way down to 4 in 3 months. So I proved the opposite. You can mess your score up in 3 months just by doing these things. And when you do that, it's damage. It's not removing waste, and it's not delivering nutrients. It starts becoming leaky and starts damaging your organs. Your organs begin to increase the risk of conditions and diseases. Now you start having complications. The last 2 steps, organs begin to fail and death occurs. I don't know if you can get back once the organs start to fail. I'm just gonna tell you the truth. So if somebody has organ failure, you need a lot more than just Endoclyx. You're the one that probably needs a super IV nutrition and a bunch of other supplements to try to rescue those cells. So IV vitamin C can help rescue your cells. And there are other IV cocktails, alpha lipoic acid, or NAC, glutathione, a lot of things we can deliver through the IV that if you ate it, your body would break it down and it's not effective. So glutathione is 3 different amino acids, but if you ate it, you would not get the benefit. So IV super nutrition is what we do for those people. And I wanted to Betty, field some questions and answer any questions that anybody has.
I have a question, Dr. Thomas. When are you going to when are you going to get the product to the Akana office to be shipped out?
Yeah, it's there now.
Is there now?
Yes.
Okay. Yes, because I had ordered some before I left.
Yeah, it's there now.
All right, thank you.
Praise.
And could you give me a call? Or do I need to call you?
Well, you mean from Akana?
No. Could you
Yeah, so
use
you would have to, you'd have to call the office because we won't be trading
No.
numbers over
This-
the phone.
No, that's not my question. I'm asking you, could you give me a call yourself or do I need to call you?
That's what I just said. So we won't be trading numbers over the phone.
Okay,
Over
thank
the
you.
Zoom. So you would have to call.
Thank you.
Dr. Thomas, this is Maria Mitchell. I talked with you at the conference. I was the one that told you I started taking the Endoclyx in February of 2025, and in March of 12th, I saw a huge difference in my bioscan. And so I wanted to take the glyco check test.
Yeah,
So,
you can definitely call the office and schedule that at your convenience. We're doing those every day now.
oh, great. Okay. Thank you. I got your card. Thank you so much.
Okay. So if there are any other questions, I want to quickly go through this.
I have a question, doctor.
Okay, go ahead.
Can we order the product from you?
Well, through this venue, you would be better if you ordered it through the Akana, through their website.
Through the who?
The person who invited you,
Exactly.
Okay,
the person who invited you
Yeah.
to the Zoom.
all
So
right.
if you're my patient, then you would just call the office and then they would walk you through getting it through Akana, because I sent out emails, so there might be somebody who my office invited. So
Okay.
whoever invited you, that's where you go through.
Okay, no problem. Do you take? What kind of insurance do you take?
Yeah, the office will handle all that. So they go through the computer and it takes, 3 minutes and they can check what's
Okay.
covered and what's not. So that's
Where's your office?
97th and Western, Chicago.
Okay, thank you so much.
97th and Western.
Thank you.
Dr. Thomas,
Yeah.
this is James Mitchell. I had a question.
Yes.
Now the Pro, I've been kind of taking that. I'm waiting for mine to come. But I had a question that I'm able to to get medications or to do things that maybe I need to do. For those individuals that may need to go, let's say, beyond that and take the infusion that you talked about, are there ways to assist someone who may not be financially solvent in order to accomplish that? And what I'm saying is they may have insurance, but their insurance may not have the infusion medications on their formulary and try to charge them thousands of dollars. And so are there ways around that?
Yeah, so our prices for infusions are nowhere near thousands of dollars, but the way I like to put it, and I don't know if this seems smart or whatever, but family and friends, everyone needs to look at investing in their health.
Yes.
You need to look at it as an investment because you're going to pay the money with sickness or you can prevent it. So there isn't really a program that I know of, but some people have a flexible spending plan. I've had patients and again, you know, I used to be OB-GYN, so, you know, those doctors sometimes have a smart mouth. So I would tell that woman, you got 3 kids and you tell them you can't afford, you know, Endocalix. I said, you gotta be kidding. You better tell them kids to fund you to get what you need to get out. You know, I go in on them because I said, I know good and well you spending a whole lot of time with them grandkids.
Uh, and Doc, I get you and I feel you, and I really thank you for your passion, because I know exactly what you're talking about, because I know guys that have spent $1,000 on an old bottle of Pappy Van Winkle, you know, but
There you
won't
go.
take care of their own self.
Right. Well, I know people who will fuss, hey, that's $300-400 a month you're spending, Doc. I said, well, hold it. When we went to your favorite place, how much did 3 of them Grey Goose and cranberry cost?
Come on, come on.
Oh, you wanted calamari and the wings?
Come on, Doc.
Let's look at the credit card. That's $600-700 last month.
Come on.
So don't, you know, if you want to have honest conversation, I'm ready to go there. But I'm just saying
I'm with you. I'm with you.
that
Well,
you
let-
don't need that Mercedes.
Come
You
on.
can't take it with you. It is not going to prolong your life.
Amen.
Now, I wouldn't say get what they used to have, a Yugo. If you're in an accident, you would crumble up like, you know, a sardine box. But I'm saying we make choices. I'm just representing the fact that you should make a choice and invest in your health, and you should ask that around you. And, you know, heck, they should become a partner with a kind of spread information and start making money that way.
That's right.
Good answer.
Good answer.
Okay,
Doc,
doctor.
I'm sorry. I was going to ask about a person who has had a heart transplant. Will this help that person who's has had a heart transplant, and the cardiologist and all the other people are telling him that his body is rejecting it, but he feels great, and he's had the heart transplant for about 5-6 years now.
Okay.
So here's what's happening. Why did he need a heart transplant?
He had some type of protein they said that was attacking his body and his immune system. He said it was genetics.
No. So here's what happened. When you don't have enough vitamin D, when your heart cells, it's time for them to replace themselves, you get more scar tissue or fibrous tissue than you get new cardiomyocytes. What does that mean? That means Black people will have more hypertrophic heart disease than any other group. Why? I just told you, because they're vitamin D deficient. So here's a person that's vitamin D deficient who has a vascular problem, and I would bet money they have never told that guy to take vitamin D to fix his immune system. So of course, the immune system is basically acting retarded and start attacking things. That's called autoimmune disease. People with low vitamin D get autoimmune disease. What's autoimmune disease? Asthma, diabetes, arthritis, lupus, and it goes on and on. So if you don't have enough vitamin D, yeah, you're going to be sicker. Yeah, your vascular system is not going to be as well. So if that guy started taking Endocalix right now, he would improve right now.
Wow.
I have a patient who actually took Endocalix before his heart transplant. Listen to me. The average person get a heart transplant, they're in the hospital about 2 weeks or so. At 7 days, he was walking up and down the hall, and they're like, what? We've never seen anybody recover that fast. Yeah, he'd been on Endocalix for a year. His blood supply was better. But at the point he got on it, the heart was already too damaged. But he left the hospital a couple of days later, a full week or so before they ever let people out the hospital. So yes, even with a heart transplant, you can improve the microvascular blood flow, and that improves the blood flow to the heart, and that improves the blood flow to the brain. Now I got to this slide. I want to quickly just go through this real quick.
Dr. Thomas,
Yes.
can I ask just a real quick question? I've got a friend that's on a fibrillator, and I don't know if they're on the list for a heart transplant, but he's being told that he needs a heart transplant. If he starts taking this, is there a chance that it might help him?
Why is he on a defibrillator?
He's got a bad heart.
No, he has a defibrillator because he might go into an arrhythmia.
Yes,
And if you go into arrhythmia and the heart's not pumping blood, you're dead.
right,
So the defibrillator will cancel that bad heartbeat. Why did he have a bad heartbeat in the beginning? The conduction path, where the electricity goes to tell the heart when to beat, was damaged because of the lack of these small blood vessels, because he ate too much fried food that caused oxidation and damaged the nerves. So blood flow, damaged nerves. So you have to change all that. So does he need a plant-based diet? Absolutely. Should he eat any more fried food? Not
No.
unless he's ready to die. Should he take Endoclyx? And my new thing, I know the company says take 4 in the morning and 4 at night if you really have a problem. That's 8 a day, right?
right.
So I looked at the pharmacokinetics, meaning how stuff is absorbed. I said, no, 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 no. These people need to take 3 in the morning, 3 at lunch, and 3 at night. That's 9 of them. So
Okay,
that makes your blood value go up faster and stay up so that you could have a faster effect. So what you have is an opportunity to change the blood flow. That means everything. And you could get it measured before and after. So if he came to the office, we'd measure his blood flow, we'd find out what his score was. And I'd put that person on three times a day, or at least 4 twice a day. And I think his blood flow would improve. And, it may or may not, once you have scar tissue, it may or may not be able to be removed. You understand what I'm saying?
yes,
If you have a big gash on your leg and it heals with a scar, just taking Endoclyx automatically isn't going to remove that scar.
right,
But you got a better chance if you have better blood flow for the scar to be remodeled. How long does remodeling take? There are 3 steps to healing. The first step, before the first step, is just your blood vessels have to contract and you got to stop the bleeding. So sometimes you got to put pressure on the wound, right?
right,
That stops the bleeding. The second step is inflammation. White blood cells and everything else you need leaks out of the blood vessels, goes into the area to start healing it. It calls forth new cells to replace the gap. So you have inflammatory stage, that's about a week. And then after that, you have remodeling. So when you have a wound, how long does it take before it gets to 100% strength like it was before? Correct answer, never. In 6 to 8 weeks, you will get 80% of the strength back into that tissue. You're never going to get 100%.
okay,
So it remodels from then on. So everybody here has had a scar that they had, and then they look down, a year later it's better, 5 years later it's better, 10 years later, you can't see the scar. So the body's going to always try to heal itself, and that's why my book is called Scarless Healing, because the original design by the designer is for your body to heal scarlessly. Your skin is replaced every 2 or 3 months. It doesn't leave a scar when it's replaced. Your kidneys are replaced every 4 to 5 years. It doesn't leave a scar when it's replaced. Those are new cells in there. And for those who want to do the research, the Atomic Energy Commission wrote a report that says we've tested people and 98% of the molecules in your body are changed every year. Every year, 98% of the molecules are changed. So I'm going to talk about this guy real quick. He had early
thank you.
Alzheimer's disease. All of these conditions happen, but the whole point I want to get to, I'm going to get to it real quick. He couldn't even draw a clock. What did they start him on? Coconut oil. After 2 weeks, that clock, at least you could say it looks like a clock compared to the first one. After 37 days, even the numbers, everything looks a heck of a lot better. Why? The brain is using coconut oil, which is a medium chain fatty acid, as fuel because that part of the cells in the brain can't use glucose no more. So they call Alzheimer's type 3 diabetes. So here's something to let you know, there's a way to fix just about everything, but you have to know the inner pattern of how it works. And you have to know sometimes you need a new pattern to replace the old pattern. You can't just keep doing the old pattern. So this guy said, what was it? After a few days, Steve said the light switch came on and my mental fog lifted. His facial tremor wasn't there no more. He now had a personality and a sense of humor, which he had lost. Dave, daily consumption of the coconut oil. You got a dose at breakfast, they cook with it, they gave it for food and lunch and dinner. Why am I mentioning this? If you take Endoclyx and get your blood flow better and take the right nutrients, you can't comprehend right now what the body can heal. It's beyond your comprehension. Because you've been told, oh, you can't fix that. But hold it. How many people have seen a car in a wreck and it looks like it's total, but then they fix the car? So there are things you could do to fix the body beyond what you think.
Dean, we spoke about this
And
when it was first.
here's a quick list
I
of
just wanted
how
to
the symptoms
clarify.
change. Here's how much the ketones, like you look at coconut oil, it has a certain amount. Ketone esters that you could buy has a certain amount. So it's a way to get it. But my point is, nutrition and blood flow can heal more than what you think. So yes, there'll be people who say, oh, you can't fix that or whatever. Nope, there is hope. No guarantee, but there's hope. So you're able to treat diseases involving free radical damage, as occurs in coronary reperfusion, diabetic angiopathy, diabetic nephropathy, that's kidney disease, inflammatory bowel disease, and pancreatitis. You can treat these diseases. We can suppress the cerebral edema and reduce the extent of brain infarction when somebody has an injury. So the last thing I'm gonna mention is that for those that come and get the hyperbaric oxygen treatment, they're actually people who had a stroke 10 years ago that have decreased muscle movement, that regain their muscle movement, because that extra oxygen, when you have better blood flow, can get to places and heal. So the sum of all I'm saying is, there's a reason why at this point in time, new knowledge is coming forth to tell you that you can regenerate the body better than you've ever known before. Your mom, grandmom, ancestors didn't know anything about this type of regeneration. But there's a reason why this knowledge is pouring out about regeneration, and I just touched the surface of it. There's a reason. And so my goal is to tell you, don't be deceived by what you previously believed, because you didn't have all the information to make that judgment. Understand that you have to do research now. And at least if you're going to put something in your mouth, you should prove to yourself that it's healthy. If you can't prove that it's healthy, then you shouldn't eat it. So that sounds kind of crazy, but that's where we are right now. It's time for each individual, and I say family unit, because once you do the research, you'll see that olive oil, canola oil, margarine, corn, there's no medium chain fatty acids in that. So you have to know so you get the right, well, I heard olive oil is good for you. We're not talking about what's good for you or not. We're talking about when you have a specific condition, there's a specific thing that you need. And diseases where you have decreased glucose uptake in the brain are all of these conditions, including type 1 and type 2 diabetes. And it's something that we can have you take that would improve your condition. And some of this, I'll just go through this real quick. Where did I learn this? I only did 3 years of pre-med at Amherst College because I was ready to go to medical school. So I left after doing 3 years. I did all the prerequisites. Then I got to Howard. I did independent research for nutrition. And not only am I a fellow of the American College of Surgeons, I'm a fellow of the American College of OB/GYN, MBA at Northwestern, nutrition training at University of California, San Francisco, and Joseph Goldberger Scholar. So these are just some of the ways in which
Come on in, baby.
so go
Yeah.
ahead. We're gonna wind it down because I decided to try doing this at the library. They're closing now, so I got 5 minutes. Any last questions? I will say this: ABC therapy. At my practice, we do use stem cells that we can get from your fat or your bone marrow. And if we inject it into the knee, it can cause your cartilage to regrow, or it can treat various conditions. And I recommend that before I recommend a knee replacement.
Dr. Thomas, is there any studies more closely with this for diabetes? My friend has really bad problems with his foot.
Yeah, so I had a relative who the year before they cut a toe off because he really had bad problems. When he came to see me, his wife is my cousin. So I said, well, here's 2 things he needs to take. And, they flew here. So I actually put him in a sterile urine container because you can only take, 3 ounces. And I had him spray that on to the skin that wasn't healing. He's at the same wound center that didn't work last year. Now, in 2 weeks, he healed better than he did in 3 months at that center. In 4 weeks, they told him, well, you don't have to come back. The wound is totally healed. The year before, they cut the toe off. So there are things that can heal a diabetic foot. There are things that can reverse. And so for those who like research, look at the Newcastle study. They reversed diabetes in 8 weeks. I'm talking about all the people who had diabetes, it was reversed in 8 weeks. So we use their protocol, we adapt it because I know most people aren't going to be able to handle 600 calories a day. I think if you take a deep breath, that's 600 calories. So we have to train you to, change your diet because as soon as we get, I think I mentioned it today, that 6% of fat out of the pancreas, we get the autoimmune inflammation out of the pancreas. We detox and get the arsenic out of the pancreas might work. Well, how's that going to happen? That's why you got to have functioning stem cells. That's why you can't have aluminum, mercury, or paraquat in the food that you're eating. So we can cover Dr. Betty, whatever, later, but I wanted to mention those things because, yes, we can help a diabetic, and there are things that are, they didn't even believe the Newcastle study.
Is that with the Endoclyx?
No, that was just a change in diet and activity that reversed the diabetes in 8 weeks.
And so the problem with people is they don't want to do that. So they're just going to continue to deteriorate, huh?
Yeah. And I can tell you right now, I'm not a saint because when my birthday came, I thought I should be able to eat what I want, smoke some cigars and do stuff too. But then when I saw my score dropped in half, I was like, uh-oh, I don't want to pay the price. Okay.
Thank
Okay,
you.
I'll be
Thank you,
calling.
everybody.
Good
You,
night.
Dr. Thomas. Very
wanna-
informative.